Hi, I'm Dr. Benjamin Thomasson with the Hughston Clinic. I've been practicing for 10 years now in sports medicine, general orthopedics, and joint replacement. I was inspired to become an orthopedic surgeon by working with physical therapists, which was my initial interest. And as I had the opportunity to work with orthopedic surgeons, see what they do and their ability to take care of things within the human body and help them return to full activity, it was something that I just fell in love with and was interested in pursuing as a career path. I would say what I enjoy most about my job is seeing people come in with a little bit of concern on their face as far as where their life is at and the difficulty their body is giving them, and then helping them through the process of healing and seeing them back to the point where they can do the things they enjoy doing. I think that's what brings me the most joy. One of the memorable cases that I had was a young lady who was unfortunately crossing the road and ended up getting hit by a car. Her knee was dislocated and had multiple ligaments that needed to be reconstructed. As a result of that injury, it took her time to rehabilitate. Over time, she actually molded her career and decided to become a nurse. I received a letter from her, which was quite gratifying to see that I was able to have a role in her life and her interest in choosing healthcare and furthering the care of patients moving forward in her life. I think what's changed most over the last 10 to 15 years in orthopedic surgery is some of the new technology that allow us to do things minimally invasive, including a needle-type camera that allows us to access the patient's need to provide care and have minimal downtime. Also, our ability to manage pain and getting to the point where now we can manage pain without narcotics, I think has been helpful for patients overall. The other thing that's been interesting is looking at the historical factors of procedures that come back into vogue as people try to search for something that's new but unfortunately already been done. History is an important lesson to be learned ahead of time so you're not repeating it in the wrong way. When I look at my life and kind of expectations for where I want to be as I head towards retirement and towards the end of my life, I'd like to be remembered for someone who played an impact in your life that wasn't overwhelming, was encouraging, but at the same time allowed you to experience growth in your own way and encourage you in that. I think when it comes to health, it's important for patients to understand that the evolution of activity is just that. It changes over time. Who you were when you were in the 20s is not who you are in the 30s, thank goodness for that. And as you become more mature, your life and activities will change as well. Probably the most important thing you can do and manage your health is, number one, stay on top of it, and then number two, be willing to make or modify your expectations for yourself and for others. As you do that, you'll find happiness in the activities you do, even as they change throughout your life. The Hughston Clinic is different when you compare it to other orthopedic practices. Not only do we focus on clinical patient care, but we provide opportunities for research and furthering medical care. The other portion there is involving the teaching aspect, not only for patients, but also in people that come through the office that are interested in being involved in healthcare. In addition to that, the Hughston Clinic provides resources that otherwise would not be available to the community, including athletic trainers, specialty marketing options, as well as the opportunity for us as physicians to be involved in taking care of not only teams, but also local Rotary clubs and providing lectures to these groups there. That way we can further the overall community health. When I look at an approach to taking care of patients, I think the most important thing for me is making sure we identify where the problem lies, not only from a physical perspective, but understanding the overall health picture. Sometimes that involves the emotional drain that comes with a physical injury. Sometimes that involves a spiritual drain that comes from changing your life over time, or specifically because of an injury. Helping patients identify the draw on their life from not only the physical injury, but the other components, I think is very important. The other thing I think is important when we manage patients' expectations is helping them understand what pain is in the process and how we manage that appropriately. It used to be we give you a medication and assume that this would solve all the problems, whereas we realize that not only is pain part of the problem, but it produces an anxiety that sometimes seems to bleed into other parts of our life. And so helping patients understand what pain is how long it's going to last, and how we can manage it without taking medications, or at least avoiding narcotics, is very important. One of the other things I think I find value in is helping patients identify minimally invasive ways of managing their pain and discomfort, understanding what the expectation is long term, but also helping them understand that there are ways that we can solve the pain and problems that may not require so much impact to their life. And helping patients get back to their life as a result of these type procedures or management strategies is what brings a lot of joy to my life.